Today we want to talk about why you might be developing a painful callus right over there.
Patients who develop callus under the fifth metatarsal head, right there, often say that they're walking on a rock. In this video, we want to go over why this happened, how to treat it, but most importantly, how to stop it from building up so fast. Hi, I'm Dr. Richard.
And I'm Dr. Blanchette.
We're board-certified podiatrists and also foot and ankle surgeons.
Today we decided to talk about the fifth metatarsal head callus because actually this was our first viral video that went over 1 million views across all platforms, actually now at 5.8 million views. Oh my God! And we'll give you a lot of information about it today. Let's dive in.
What is a callus?
A callus is basically a buildup of dead skin that occurs usually on the bottom of the foot. And it happens because of friction and pressure.
And within that callus, patient can sometimes develop a corn. A corn is basically a hard core. So when you press on it, it's so painful.
And oftentimes they are saying that they feel like they're stepping on a rock. Why this happens?
Now let's talk about the most common root causes why you develop callus under your fifth metatarsal head.
First one is for a Cavus foot or a very high arch foot.
That's actually my foot type. So with a high arch foot, it's a more rigid foot type. That means when you go into your mid stance, you're not gonna collapse as much.
There's very minimum shock absorption.
We often call it the tripod foot.
In the tripod foot, there's a lot of pressure at the heel, at the fifth metatarsal, but also at the first metatarsal. I usually tell my patient or show them that they're actually walking on the side of their feet. And that causes a lot of pressure, especially at the fifth metatarsal head.
Yeah, and if you look at the shoe of those patients, it's often more worn out, also on the outside. Number 2, tight calf muscle.
This is very common and is causing a lot of pressure at the front of the foot.
It's actually called Equinus. So if you have a tight calf muscle or a tight Achilles tendon, during gait, you're gonna have an early heel lift, and that's gonna compensate by putting more pressure on your forefoot. And more pressure, develop more callus.
Number 3, plantarflexed fifth metatarsal.
Sometimes the fifth metatarsal sits just a little lower than the other ones.
On a neutral foot, usually the heel and the front of the foot are supposed to be in the same plane. But sometimes that fifth metatarsal is a little sneaky and it's a little bit lower and it's gonna have a lot more pressure. Sometimes also you can have a centered core in the callus, and they can be due to the little condyles on the bottom of the fifth metatarsal. There's 2 of them, and then if the metatarsal is a bit lower or there's more pressure, you can have 2 pinpoint areas that are very, very painful.
Number 4, Tailor's bunion.
We all know what a bunion is, right? It's on the inside of the foot where the big bump is. But there's also something called a bunionette or a Tailor's bunion, which is basically a bunion on the outside of the foot.
And because the bump sticks out over there, there's more friction inside the shoe, and that can develop more callus.
If the other metatarsal, 4 metatarsal are closer together, the pressure is distributed more evenly over here. But when this guy is on its own over there, there's a lot of pressure that's gonna go on this particular bone. Number 5 is a hammertoe.
If you have a rigid hammertoe, basically your toe is crooked. And what it does is that the phalanx lifts up and push down the metatarsal head, so it creates retrograde pressure. It presses the head of the metatarsal down, increasing the pressure from the ground. Look at this. On this pressure mat, you can really see that there's overload, too much pressure under the fifth metatarsal head.
Today we're gonna give you a lot of information, but don't worry. We created a free PDF that you can grab down below. It's gonna go over everything that we're gonna talk about today.
Okay, let's go over the treatments. Office treatments.
When you have a painful callus and you feel like you're stepping on a rock, the best thing to do is to go to the podiatrist's office to have it shaved with a sterile instrument.
It's called sharp debridement, and it's gonna make you feel better right away.
Yeah, oftentimes people leave the office and they feel like they walk in a cloud.
Don't be scared because it's quick and painless.
It's painless. We're only removing dead skin, so there's no nerve ending on what we're removing, and it's gonna feel so much better after.
Especially if the doctor removed that central core, the rock is gonna be gone.
Home maintenance.
You can do things for your callus at home.
We're gonna go over a few different things that you can do, but caution here. If you are diabetic, have bad circulation, or have neuropathy, you should not attempt this at home.
Exactly. Go see your doctor first. The first one that everybody knows is a pumice stone. We still need to mention it. So after a shower, when your skin is soft, you can use a pumice stone to do maintenance of that extra skin.
Use it for about 30 seconds and 2 to 3 times a week. Next is keratolytic agents. Those are creams that are going to help to break down the buildup of thick skin.
One of those that we always recommend is Urea cream. And I usually go for the 40%, but that comes with a caveat because if you're diabetic, 40% is going to be too high for you. You should go around 20.
Other keratolytic agents are also ammonium lactate and glycolic acid.
Pro tip, this is how you're going to get the best result. Take your shower, use a pumice stone, then put your keratolytic agent cream on and Saran wrap. Or
silicone socks that will create an occlusion. So the cream is going to stay closer to your skin, it's going to penetrate deeper and give you the best effect. Quick pause. If you find value in this video, please consider subscribing to the channel. It's a free way to show us your appreciation. Now let's fix the root causes. Number one, if you have a tight calf muscle, to do calf stretching is really going to help. You can take a towel, put it at the front of your foot, and then you're going to pull on your towel. It's going to stretch the calf muscle. You hold this for about 30 seconds and do that 2 to 3 times a day.
okay, next one is peroneal tendon strengthening. This one is really important if you have a high arch foot, because with high arch, your foot is going to roll like this. So all of the pressure is on the outside. By strengthening the muscle that brings your foot in eversion like this, it's going to balance that foot deformity and decrease the pressure on the outside of your foot.
How to do this? You can sit on a chair and you're gonna wrap a resistant band around the front of both of your feet. The working leg is gonna be pushing the band towards the outside. You have to be careful to move your foot, not your leg, so that you're really isolating the muscles. We recommend to do 15 repetitions of 3 sets and to do that 3 to 4 times a week.
Custom orthotics. This one is great for long-term treatment.
Especially when we talked about earlier that this happens often when people have a cavus foot or a high arch foot. So to control the mechanic is really going to help to decrease the pressure on the outside of the foot.
Few specific prescription points we can add to a custom orthotics for a patient who has a callus underneath the 5th met head are extra padding, 5th metatarsal head cutout, a reverse dancer's pad, or even a lateral bar.
We can also add posting to the back of the orthotic to bring your foot more towards the inside. And to get a proper custom molded orthotics, we recommend to go to your local podiatrist. Another great tip is to use a reverse dancer's pad. And I'm using a 1/4 inch felt padding, which is adhesive. We're gonna trace what we need first. Now you have 2 options. You can either stick it directly on the foot, but then you're gonna have to change it daily. Or even better, you can put it in a shoe. What I recommend is to put it underneath the liner of the shoe. So you can put the liner up onto the foot, find exactly where the point of pressure is. Even better, if you've been wearing your shoes for a little while, oftentimes you're gonna have a point of pressure that's gonna show on the shoe, and then you can just isolate this exact area. Once you know where the 5th metatarsal is, you're then gonna put your padding right over here, and it's not gonna cause pressure anymore. And the fact that the padding is on the bottom of the liner of the shoe, this piece is not gonna be moving.
Shoe choice. Shoes actually makes a big difference. So when you have a callus on the outside of your foot, we recommend a shoe that has a thick sole that's gonna absorb the shock. You also need to have a wide forefoot so there's less friction on the outside. Very important that you don't get a shoe for flat feet or overpronation, because these ones have more support in the inside and that's gonna push your foot like this, more pressure here. So you want to get a neutral shoe.
The type of shoes matters as well. You're gonna have a lot more cushion with a sneaker like this, or even like a lower loafer compared to a heel. So if you put like a high heel shoe, there's gonna be a lot more pressure at the front of your foot and it's gonna feel uncomfortable. When surgery is considered?
Surgery is rarely the first option, but it's sometimes considered if you failed all of the treatment and you have pain on a daily basis. And usually the doctor, the surgeon, is going to evaluate the root cause. So for example, if you have a bunionette, you can have a bunionette surgery, or if you have a rigid hammertoe, you're going to have hammertoe correction. Oh, let's be clear. The surgery is not to remove the callus itself. It's to correct the foot deformity with the goal to realign, give you better function, decrease pain.
Once the surgery is done, oftentimes there's not going to be any more callus on the area. But also in some occasion, you could still have some residual thickened skin on the area. Skin sometimes has memory, meaning that if you've had a callus there for a long time, it's still going to produce a little bit more skin than the surrounding areas, but definitely it's going to be so much better if the pressure there is reduced with surgery.
Okay, that's a wrap. We really hope you enjoyed today's video.
Don't forget to grab your free PDF. The link is in the description down below.
Okay, till next time.
Bye.
Ciao.